Welcome. My name is Michelle Morand, and welcome to Cancer Just the Facts. This is an online program and an online educational community where we are going to be sharing with you the most current science-based medical research on the most advantageous diagnostics and treatments, diet, supplements, alternative therapies, everything that you might be wondering about as to whether it's right for you and how beneficial it is and what you need to do to get access to it. That's what this program is about. It's about pointing you in the right direction, all based on science. What we need to understand is that there are thousands of innovative and FDA-approved therapies available right now for a variety of molecular features or genetic mutations. But the genetic testing that needs to be done in order to match the patient to these particular treatments is not a part of standard of care in most countries just yet, although we're working on that. Independent of that, the analysis of the testing results, even if patients take it upon themselves to get some decent testing done, the analysis of that data is not provided as part of standard of care, and your medical oncologist does not know how to do it, nor do they have the time. So when you take it upon yourself to get proper testing done, if you don't have thorough analysis and you don't have a team advocating for you, or you aren't well educated on how to advocate with your doctor, even the best testing will often fall short of being properly utilized because the tests themselves don't exactly tell you everything you need to know about what treatments are going to be best for you and about how to access them. All that is to say, think of peer-reviewed scientific data as a kind of currency, as a way to open doors, to get things done, to grease the wheels of the medical system. That's how you need to think about it. So the more accurate and validated the scientific data you provide your doctor, and the more efficiently you can provide it, and the more support you can give them in terms of how to get the drug for you or the combination of therapies that you need, the greater your chances are of getting the prescription you need from your current medical oncologist, even if they've told you there are no more options or they're out of options and there's nothing more they can do than maybe palliative chemo or whatever it is they've prescribed. When you have good scientific-based evidence to support your request for particular treatment, and when you provide your oncologist with all of the information they need, neatly, concisely, simply, you make it possible for them to provide something far more effective for you without them having to take time away from their other patients. And that's really important. So all that is to say, in this program, we're going to teach you how to make sure you get the most thorough and accurate diagnosis. We're going to teach you how to make sure that that is analyzed as effectively as possible. And we're going to teach you how to prepare all the information that your medical oncologist needs, how to get that currency into the hands of your doctor to make sure that you get the prescription as quickly as possible. We're also going to talk about alternative therapies, which ones really have proven merit and which don't, and which specifically are going to provide you with the most benefit and at what times in your therapy. Also, we'll talk about supplements and a variety of other questions that I'm sure you have as a cancer patient. There's so much uncertainty when you're dealing with a life-threatening illness. You've never been here before. You've never had to go through this before. It's really important. And there's a lot of things you're not in control of. And that creates a level of anxiety that can make us reactive. It can make us make choices that are not actually in our best interest simply because we're so anxious and we feel like we need to do something. This course is not just about providing you with that currency of knowledge that you need in order to make sure your doctor does what you need them to do. It's also so that you can have as much peace of mind as possible, because you will be able to tell when a particular treatment really has merit for you. You will be able to tell when a particular website or supplement or whatever it is that's being recommended to you has proven efficacy and makes good sense for you specifically, versus when it might be fine for others but not for you, or it might have no merit whatsoever. You being able to take away some of that uncertainty is one of the most important elements in your peace of mind and in your success with your cancer treatment. And that's what this program, Cancer Just the Facts, is all about. So we've got written lessons, we've got video lessons, we've got some quizzes for those of you who like to challenge yourself and make sure you've understood things well. There's downloadable PDFs, and every week we have a live Q&A on Zoom with the precision cancer medicine expert, Alexander Rowland, and with myself, your advocate and educator. We encourage you to send your questions ahead of time so we can do a little bit of preparation and make the most of our time together. But join us, ask your questions, get to know us. Just make sure that you are making the most educated decision every step of the way, and you will have the best possible outcome that you can have with your cancer treatment and the most confidence and peace as you're journeying towards that complete remission. I look forward to seeing you in our live Q&A. Feel free to throw questions into the chat of the course anytime. Every unit has lots of spaces for you to ask questions or share your feedback. We want this to be the most beneficial program possible. Please don't hesitate to give me your feedback about what made sense or what didn't make sense. We will be constantly adding new information, so this course will stay current. Everything that we're going to share with you will be the most current peer-reviewed medical science data. We look forward to seeing you in our live Zooms every Wednesday at noon Pacific Standard Time, and to chatting with you throughout the course.